So the next one is your primary hyperparathyroidism and hypoparathyroidism. And like I explained, when you are doing endocrine condition, when you are monitoring the hyper, patient might be going to hypo. And when you are doing hypo, patient might be going to hyper. So we are talking about hyperparathyroidism. So what is this hyperparathyroidism? It is when there is elevated calcium and low phosphorus. Again, high calcium and low phosphorus. Anytime somebody asks you that question, what is primary hyperparathyroidism? It's an it's caused by overproduction of the parathyroid hormone PTH. Parathyroid hormone. That PTH is parathyroid hormone. So it's always caused by maybe they have a parathyroid adenoma, okay, leading to elevated parathyroid hormone and hypercalcemia, high calcium and low phosphorus. So excess PTH increases bone resorption, renal calcium reabsorption, and intestinal calcium absorption. So what is this telling us? The patient is going to have high calcium, okay, renal calcium reabsorption, excessive, okay, increase in bone reabsorption, renal calcium reabsorption, and intestinal calcium absorption. So just remember, patient may start having like a lot of stone problem, bone problem, okay, like bone pain, fractures, abdominal pain, constipation, and when you check their lab, patient is going to have high calcium and low phosphorus, and they are also going to have elevated alkaline phosphate phosphatase. I have mentioned this before, alkaline phosphatase. So it's going to be elevated. So this is the lab. Under the lab, the calcium will be high, which is what I'm emphasizing on. The PTH, parathyroid hormone, will be high, and the phosphorus will be low. But the alkaline phosphatase will be elevated too. That is it. And also, what is the treatment? Of course, the treatment is going to be surgery because there is an overproduction. Remember, it's hyper. But if you want to give them medication, the medication that we usually give for the purpose of the exam is biphosphonate. If you remember where we saw this biphosphonate before, it was under musculoskeletal, under the treatment of osteoporosis. So it's still the same thing that is happening here. So they are going to give them biphosphonate. Biphosphonate is going to help to preserve bone loss. Biphosphonate. So these people are going to have a lot of fatigue, poor memory, osteoporosis, low libido, bone and joint ache. But for the emphasis for the exam, patients that have hyperparathyroidism is it shows increased calcium and low phosphorus. High calcium and low phosphorus. Take note of that. And if these people have a high calcium and low phosphorus, we say that surgery, which is parathyroidectomy, is the most definite treatment. But the medication that they can give them, because the medication they can give them is biphosphonate. So this biphosphonate will help to preserve bone loss. But then we have hypoparathyroidism. Now it is low. So what is low now? The calcium is low. So it's opposite of hyperparathyroidism. So this is hypoparathyroidism. So in hypoparathyroidism, the calcium is low, and because there is an insufficient secretion of parathyroid hormone. So because this calcium is low, what is going to happen? Patient will have a lot of neuromuscular irritability. So patient is going to have a lot of tingling of their hands, feet, muscle cramps, tetany. Okay. So remember, this is opposite of hyper. So for the exam, patient is going to have these signs. We call it um, weakness and tetany. We call it positive trouser sign, which you should know what is positive trouser sign, and positive Chvostek sign. So this is the picture here. The positive trouser sign is when you are inflating a BP curve. Okay, there is induction of the carpopedal spasm by inflation of the BP curve. Okay, sphygmomanometer, when you are inflating it. So the person is going to have this abduction of the thumb. Just remember, nobody is going to tell you to explain this in the exam, but just know that is the trouser sign. Just think about when they are inflating a blood pressure curve. When they are inflating it, there is that carpopedial spasm. Okay, but Chvostek sign is contraction of the ipsilateral facial muscles elicited by tapping the facial nerve just anterior to the ear. So when you tap anterior to the ear, somewhere here, the person is going to respond by twitching of the lip. You can see their lip, twitching of the lip to spasm of all the facial muscles. So these are all the signs and symptoms of low calcium. They are going to have tetany, they are going to have trouser sign, which is very high yield in the exam. Tetany is very high yield in the exam. Chvostek sign is very high yield in the exam. Trouser sign is very high yield in the exam. And these are the signs of hypoparathyroidism. Of course, you are going to remember they're going to have muscle cramps. They may end up with seizures. They may end up with tinglings of the hands and the feet. Okay, but the major thing for the emphasis for the purpose of the exam, know the Chvostek sign, know the trouser sign, know tetany. Okay, so what is the management? The management is to focus on calcium supplementation and active vitamin D. So they are going to give them vitamin D. So that is the treatment. So that is the treatment, vitamin D and calcium. So this is treatment of hypoparathyroidism. Treatment of hypoparathyroidism. But when we talked about hyper, we say that the treatment for hyper is surgery, or the medication is biphosphonate. So please don't forget what we talked about, very high yield in the exam. The para hyperparathyroidism, they are going to have a lot of stones, they are going to have mood issues, But under low calcium has a lot of things to do with the muscles, the twitching, the trouser sign, the Chvostek sign. So please don't forget that. And the treatment for primary hyperthyroidism is surgery, or you can do biphosphonate. While the treatment for hypo hypo is your calcium or vitamin D. Okay. So one more table just to remember for emphasis. This is just a summary of what we went through. In primary hyperparathyroidism, the PTH parathyroid hormone is high, but it is low in hypo. Calcium is high in hyperparathyroidism. Calcium is low in hypo. Please take note of that. Phosphorus or phosphate is low in hyperthyroidism, is high in hypoparathyroidism. Okay. So what is the symptom which we emphasize a lot? They have a lot of bone pain, kidney stone, abdominal pain, depression. But under hypoparathyroidism, it is all about Chvostek sign, trouser signs, tetany, muscle cramps, tingling. Then the treatment is parodactomy, which is surgery, or they can also do by phos- biphosphonate. Okay, biphosphonate, we covered it here. Biphosphonate to preserve bone loss. So you can just update your, so biphosphonate to preserve bone loss. Then hydration, okay, because they have a lot of stones. Then the treatment for hypoparathyroidism is your calcium and vitamin D. Please take note of those things we have mentioned.